I'm Cook County Commissioner Scott Britton. Vaccines have been in the forefront of just about every conversation, certainly that I've had recently. And a shortage of doses paired with an excess of demand has created a lot of frustrating situations with people in the 14th district as they try to find a way to get vaccinated. And the appointments have been somewhat hard to find. One other issue that we've also dealt with is vaccine hesitancy. So I wanted to get an expert in both the medical treatment of people in an ER situation, people who have COVID, and then the vaccines itself. And we are very, very fortunate to have Glenview resident and Dr. Halleh Akbarnia, who is going to talk to us a little bit about what it is to be a both emergency room physician in the age of COVID, and also a little bit more about vaccines and why you can be very confident to take one if you wish, and to protect yourself against this very significant disease. Doctor, thanks. I know you have a very packed schedule, and I'm incredibly grateful that you would sit down with us and talk to our residents and my constituents about the 3 vaccines that are available for use by the general public. Before we start talking about vaccines and COVID-19, can you just tell me a little bit how you became an ER doctor?
Sure. Thank you for having me. It's a pleasure to be here, especially as a Glenview resident, just to see all the great things that are happening around us here. I'm very proud to live here right now. I decided to go into emergency medicine in a kind of a different path. Initially, I started off as wanting to be an orthopedic surgeon. And I think during my year of doing the first year of surgery, I realized that I kind of did like every aspect of that year. So it wasn't just one type of surgery I wanted to do. So for me, being able to be a physician that could help my community and just be able to be more someone who had a little bit more knowledge of all things out there, and to be able to kind of the adrenaline that came with it, I think was a huge thing for me as well too. I'm not one that likes to kind of sit still, so office work didn't appeal to me as much, and for me, just the public health aspect of it also was very appealing. So that's kind of the decision to be an emergency physician. I'm the daughter of 2 physicians. One's an orthopedic surgeon, one's a pediatrician, and I think I was first kind of heading that way, but I kind of veered to ER after doing rotations in it.
So what's it been like being an ER doctor during this COVID pandemic?
Yeah, that's been something that's been a definite roller coaster. I mean, we're built to take hits, essentially, like we're supposed to go with the flow, and we tend to be physicians that can pretty much handle most situations, but I don't think none of us were ready to handle what kind of hit us last March. All of us have stories to tell, and especially in the hospitals that I know I've been a part of, our numbers were extremely high right from the beginning. And the devastation and the pain that we saw in the beginning in families and just communities was just beyond something that I think any of us will be able to really know the effect of for years to come. I think it affected all of us in ways that we still don't know. You know, we haven't stopped yet to be able to assess really how that affected everybody. Having said that, it was probably some of the hardest months I've had as a physician. But at the same time, now on this end of it, it's a pleasure to work with groups trying to get the vaccine into arms. And for me, it's been therapy. It's been the ability to be able to get vaccines to all locations. I've been helping down in the city quite a bit, trying to get events set up for underserved populations, helping our community here. All of that to me is just every time I know that someone got a shot in their arm, to me it's one more step closer to the other end of this race, basically.
Absolutely. And again, thank you so much for the literal life-saving work that you've been doing in the ER. And now we have at least something a little more positive to talk about as we discuss vaccines.
Absolutely.
And again, Cook County Health, which is part of the supervisory authority I have as a Cook County Commissioner, has been very significantly involved in vaccine distribution in suburban Cook. So first off, I have had a lot of people asking me about both the amount of adverse reactions and the severity of them. Can you just describe for the people who might be watching this what the adverse reactions have been from your perspective as a physician?
Sure. I think I look at it a little differently. To me, a reaction to the vaccine is normal. Um, Typically also after the second shot, if you're doing a 2-dose vaccine. It's your body's immune system kicking in and basically producing the antibodies that you need. So when you will see the real infection, that you can fight it. Different people mount that in a different way. I know that for me, the second shot that I got mounted quite a good response, and I had a pretty high fever. But it was my body's way of producing antibodies and the immune system kicking in, and different people have reactions that are different. So we've seen people with localized rashes on their arms, people who have had some lymph nodes that have been swollen, people who just kind of feel just a little fatigued, small headache, the more typical, and some people with nothing. And none of that means anything other than each body is different in how they respond to building their immune system. So those are the reactions that I think people are talking about. But to me, they are natural reactions to what is supposed to be happening anyhow. And I think part of our job was to get out there to people that, yes, you might have some reactions, but don't worry about it. It's your body basically doing what it's supposed to do. So don't let that prevent you from getting the second shot. You need that second one.
Absolutely. And you know what, when we were talking before we began recording, you did make it clear that the testing that was done for all three of the available vaccines in the United States did include pregnant women, for instance.
Absolutely. Yeah.
And do you have any concerns about women who are planning to get pregnant, who have been vaccinated, that there could be any potential effect on a future pregnancy?
My only concern is that they avoid getting it. That's my only concern. I feel that pregnant women are at a high risk of developing very bad COVID if they do contract it, that they absolutely need to protect themselves and their unborn child by getting the vaccine. And the way these vaccines have been designed is that theoretically there's no way to see that these end up crossing the placenta as a vaccine, but it's your own body's natural response that the baby benefits from as well. Your own body's ability to produce the antibodies that the child will then possibly be born with as well. So you're creating a safer environment for them. And I mean, to see a pregnant woman who has developed COVID, and we've seen a lot of really young, healthy women who've developed it and not done well, is heartbreaking. It's heartbreaking for obviously their own family, but just knowing that if they didn't, how much, the side effects and even the final outcomes are just devastating. Yeah.
Well, doctor, one thing I do also try to remind people that, there's been a lot of talk, and obviously the science of this is both somewhat unique in that it's relatively new, the way that this has been done through the messenger RNA. However, it does not change your personal DNA. It simply causes a response that creates antibodies. That's what it's designed to do. It doesn't change who you are.
Absolutely. I mean, this is a virus that has been so devastating that having something that is this smart to fight against it has been just mind-blowing in the scientific world. And knowing how this works and knowing that it absolutely alters nothing, that basically it's your body that's creating all the response to it, is just amazing. That's, I think, the part that people don't understand is what is being injected into your arm is such a small amount of protein that this spike protein basically for the messenger RNA sits on, and then the rest is what your body is creating. And immediately after it gets injected, it gets disintegrated. So it isn't even in your body for very long. It's amazing how this technology works, and it's been studied for a long time. It's just not been used in this format.
Or obviously in the hundreds of millions of doses, which is
right. Yeah.
So the other thing I get a lot of, doctor, is Pfizer, Moderna, and J&J. I've heard people say, the numbers are so much better with Pfizer and Moderna. I'd rather hold off and get those. I know Dr. Fauci has said you should probably get whatever vaccine's available. And I think he knows as much as anybody about this whole disease process. So is there any significance to the studies that were done as to these three vaccines, as to their relative effectiveness, or whether you should prefer one over the other?
No, I would definitely go with what he says on this. The first vaccine that comes your way is the one you should get, and you should not wait for the next one. And even now that you might have a little bit more of an option, it really is hard to tell which is better. If I was trying to figure this out, if I had to advise someone, a good friend of mine, or a relative, which one to get, essentially it would be the first appointment you can get, you should get. At this point, I don't have a preference as to the two because I think that they were studied slightly differently. For the Moderna and the Pfizer vaccines, their efficacy has been shown to be 94, 95%. That means that if you're vaccinated, maybe 5% of the time you would develop symptomatic COVID. And that also means that there are a percentage of people that may have had asymptomatic COVID in those studies that weren't studied, but that number was very insignificant in how things got transmitted. It also showed that, let's say for the Moderna vaccine, the first shot is about 80% effective. You need the second one to get up to 95%. For an mRNA vaccine, you have to have both. You can't think that, well, maybe I should get the first shot of Moderna only because it's 80% instead of the 72% J&J. Totally different way this vaccine works. So you need both for the mRNA to really mount a really good antibody response on the other side. With the J&J, it's an adenovirus vector vaccine. So it works differently. It's completely on a different mechanism. It's kind of more classic vaccine that we've seen. So that one shot will mount a really good response so that once you get that shot 2 weeks later, you have a pretty strong reaction. And then 4 weeks later, you're completely there. So you can't really compare the two. And I think what happens is when people do compare it, it's hard to really decide which one to do. And so that's why I think that because they both work in different ways, you just get the first one that comes your way.
Sounds great. And Doctor, I know that you've been really an integral part of our volunteer legal community here in Cook County. Can you tell me a little bit about IMPACT, which is Illinois Medical Professionals Action Collaborative Team, and the work that they've been doing as it relates to the pandemic?
Sure, absolutely. This is a group of healthcare professionals who, when they were created, was in the very about a year ago. This week was when they developed as a group. They were a group of healthcare professionals who kind of got together to amplify healthcare voices and also to advocate for science-based public health messaging and policies. They've worked with communities throughout this entire pandemic, partnered with other organizations. They've gotten PPE to people, basically spread the word, and also a voice between the healthcare professionals into our government as well, with different opinions, pieces, and articles that they've written. So they've worked with social media and the press to try to get the word out. They found me a few months ago when I was kind of doing my thing out here and trying to put together a list of vaccine resources for my community. And it just happens that one or two of the members live in our district area as well. And she approached me and said, "You're doing what we are doing. You have one more thing that we don't have, which is the vaccine resources." And also I was developing a group of volunteers that I put together. And now I have about 1,400 volunteers that are under my name. And that whenever there's an event that comes up or something that is out there and they need help, I'm able to get a message out quickly to this group and get people to staff it, which has been very great for me too, to be able to get people who want to help out there helping. And these are both medical and medical people. So it's good for everybody.
That's great, Doctor. And believe me, for all of the tragedies that we've had of people not only getting sick, but well over 500,000 people dying, there's also been an enormous outpouring of help and care and volunteerism, things that have really made it a lot easier for us in government, and I know you in the healthcare field, to try to get everybody healthy and to now try to roll out this vaccine, which is such a godsend for everybody in our district. So I guess at the end of this conversation, if I were to guess, the one thing you'd want to try and impart to people would be that if you can get a vaccine, get a vaccine.
Get a vaccine. We are not quite there yet. We're almost there, but we need everybody to get a shot. And the quicker we do it, the closer we get to herd immunity, and then we can get back to life again. Already there's enough small little pockets of normalcy being seen out there. My advice is to not take advantage of that. Still, if you're not vaccinated, protect yourself, protect your loved ones. If you are vaccinated, basically keep your groups very limited to people who are. And there's also a reemergence type phenomenon out there too. People are having a hard time getting back a little bit of that normalcy because they feel guilt, they feel that they've been isolated for a year, and to watch out for each other, because we're starting to see a lot of kids and a lot of people with mental health type issues coming from even just getting back to normal again. So we really have to kind of keep a really good eye out for each other too.
That's a very good point, Doctor. So I want to thank you so much for spending this time with us. It has been people like you who have made this process much easier for people like me in government. And for those watching, again, it has been a challenge to roll out this vaccine, something we have not done ever at this level. But I can tell you that things are looking much better. Our supply is increasing substantially. And I think we are going to be in a position where anybody, as the president has indicated, any adult who wants to have a shot in May will have the ability to set one up. And that is a truly remarkable.
It's a great thing.
So Doctor, thank you again for everything, and we'll see you around. Thanks so much.
Thank you so much for having me.